Alright, so I'm going to go ahead and do a hopefully quick rundown of the muscle chart we're given. And I'm going to start here by talking about the muscle, and then its attachments, its innervation, and then its functions. Okay, so what we have here, so let's start out with the trapezius. So we need to know the trapezius. And the trapezius is a muscle that attaches the upper extremity to the axial skeleton. So you got the trapezius, and it's going to be attached to the posterior skull and to attach to spinous processes. And it's going to also be attached to the spine and acromion of the scapula and the lateral clavicle. Now the trapezius's innervation is going to be through the spinal accessory nerve. So that's cranial nerve 11. And what the trapezius is going to do is the trapezius, or the traps, are going to elevate the scapula, it'll depress the scapula, it'll retract the scapula, and it will boy duct the arm as well. Alright, so another muscle attaching the upper extremity to the axial skeleton are the lats. So you've got the latissimus dorsi. So the lats are going to be attached to spinous processes of the thoracolumbar fascia and the iliac crest. It's also going to be attached to the proximal part of the humerus. Now, the lats are going to be innervated by thoracodorsal nerve, which is the posterior cord of the brachial plexus. And the lats are going to, functionally, they're going to adduct medial rotate. They're going to do adduction. They're going to be involved in medial rotation. The lats will also extend the arm. Okay, so then another of these axial muscles that attach the upper extremity to the axial skeleton is the levator scapula, or scapulae, and the levator scapulae will be attached to the transverse processes of the upper cervical vertebra, and it'll also be attached to the superior angle of the scapula. Now, the levator scapulae is going to be innervated by dorsal scapular nerve, or C5 root of the brachial plexus. Now, levator scapulae does exactly what it says in the name. It elevates the scapula. So then also the rhomboid. Both the rhomboids are muscles attaching the upper extremity to the axial skeleton. So the rhomboid minor is going to be attached to spinous processes of C7 and T1 vertebrae, and also be attached to the medial border of the scapula. Now, the rhomboid minor will be innervated by dorsal scapular nerve, which is a C5 root of the brachial plexus. And then the rhomboid minor is going to elevate and retract the scapula. Now, the rhomboid major, pretty similar. The rhomboid major is going to be attached to the spinous processes of T2 to T5 vertebra, and also to the medial border of the scapula. Rhomboid major will be innervated as well by the dorsal scapular nerve, just like the levator scapula and rhomboid minor. And this is all, the dorsal scapular nerve is part of the C5 root of the brachial plexus. And just like the rhomboid minor, the rhomboid major is going to elevate and retract the scapula. Now, we've also got a few more to go here of these muscles attaching the upper extremity to the axial skeleton. So we've got the pectoralis major, so the pec major, can't really see it well here, but the pec major is going to be attached to the clavicular head, or the medial half of the clavicle, and it'll also be attached to the sternocostal head, or sternum, and the first 6 costal cartilages. It's also going to be attached, the pec major is also going to be attached to the intertubicular sulcus of the humerus. Now, the pec major is going to be innervated by lateral pectoral nerves, and these lateral pectoral nerves, these medial and lateral pectoral nerves, these medial and lateral pectoral nerves that innervate the pec major are going to make up or be a part of the medial and lateral cord of the brachial plexus, respectively. And so the pec major is going to do AD dog duction and medial flexion. The pec major also does medial rotation, and the pec major does AD dog duction of the arm. Alright, so we also have the pec minor. Sorry. We also have the pec minor, and the pec minor is going to the pec minor is going to be attached to the ribs and costal cartilage 3 through 5. And the pec minor is also going to be attached to the coracoid process of the scapula. Now, the pec minor is going to be innervated by medial pectoral nerve, which is going to be a part of the medial and lateral cord of the brachial plexus. And the pec minor is going to involve depression and protraction of the scapula. Now, the subclavius is another of these muscles attaching the upper extremity to the axial skeleton. The subclavius is attached at the first rib at its costal cartilage, and the subclavius is also attached at the inferior middle clavicle. So the subclavius is going to be innervated by nerve to the subclavius, and that will be a part of the superior trunk of the brachial plexus. And the subclavius is going to depress the clavicle. Okay, and so now we've got lastly one more of these muscles that attach the upper extremity to the axial skeleton, and that's going to be the serratus anterior. So the serratus anterior is going to be attached to the lateral ribs, and the serratus anterior is going to also be attached to the medial border of the scapula. So the serratus anterior is innervated by long thoracic nerve. It's going to be C5 through 7 roots of the brachial plexus, and the serratus anterior is going to do abduction of the arm above the horizontal line. All right, so that is the muscles attaching the upper extremity to the axial skeleton. So we got a little bit more here to go.